For our evidence-based practice project, we were assigned the population of gambling addicts. Gambling is defined as including all gambling behavior patterns that compromise, disrupt, and/or damage personal, family, or vocational pursuits. Contributions to gambling addiction include increase in accessibility, legalization of new forms of gambling. In fact, 70–80% of people actually reported they gambled in the past year. Gambling can escalate to addiction that can be associated with adverse personal and social problems that include the following: global health concern, impaired health, unemployment, financial difficulty, and family violence.
This is clinically significant because gambling is often associated with comorbidities, including things like nicotine dependence, substance use disorder, as well as others like depression, anxiety, and even suicide. Many individuals are unaware of the effects that gambling can have on their lives, and thus the increase in access is leading to an increase in the number of people seeking help. The aim of our study is to use an assessment tool to identify individuals with gambling addiction in order to refer them to the appropriate providers who can then individualize treatment.
So the method was to review primary research articles and literature for an assessment tool. We found the South Oaks Gambling Screen, which is a 20-item questionnaire based on the DSM-3 criteria for pathological gambling. The South Oaks Gambling Screen includes 7 categories, which are family disruption, job disruption, lying about gambling wins and losses, default on debts, going to someone to relieve a desperate financial situation produced by gambling, borrowing from an illegal source, and committing an illegal act to finance gambling. As nurses, we have identified methods to most help these patients, which include continuous reassessment and working with the patients.
Using the South Oaks Gambling Screen to assess patients helps identify those who may be suffering from a gambling addiction. When results show a suspected gambling problem, the nurse will relay this information to the physician, who will make the appropriate individualized treatment referrals. In a study, the South Oaks Gambling Screen assessment tool provided 96.7% true positives in comparison to independent gambling counselor assessments. That being said, the South Oaks Gambling Screen assessment tool has been proven to be effective in identifying patients with gambling problems, and we hope this will result in patients receiving the best possible treatment.